Hi guys, Derm here. I want to take a few minutes and talk about a topic that is particularly important to a lot of our patients. We treat quite a bit of acne in our clinic, and a lot of times people are on topical creams using various moisturizers, soaps, that kind of thing. And it is always helpful to try to clarify how to use topicals when treating acne. So keep in mind, topical acne treatment is very common. It's usually used for mild to moderate acne, but it's often used in addition to other treatments for severe acne as well. So first thing, cleansers. Generally, my recommendation for folks is to use something very mild, Dove, Cetaphil, any kind of mild soap really. If you have oily skin and want to go up the ladder to something stronger, you can always use dial soap. And it doesn't have to be any special formulation, just something mild. Don't overdo it on the face in particular. A lot of the acne topical treatments dry out the skin, and we don't want to use a harsh cleanser that dries out the skin to the point where you can't use the acne medication. So that's the main issue here. So benzoyl peroxide used very frequently in a wash. It works great, has an anti-inflammatory effect and antibacterial, so it helps with the pimples in particular. The main issue with benzoyl peroxide is that it bleaches clothing. You have to be real careful, make sure you wash it off properly, and be aware it probably will bleach your towels and possibly your clothing as well. So just kind of start out, wearing things that you're not worried about ruining at first and see how it goes. So third thing, creams. There are many different creams that are used for acne. Without really going into the specifics, I have other videos that kind of talk about that. But the bottom line is a lot of the acne creams are very effective, but they're also very drying to the skin. And the limiting factor for usage is the dryness. So really what I tend to suggest to folks is start off maybe once or twice a week, ease into the cream, and then slowly increase it to maybe every other night. So if you have two creams, you can just alternate them. Use one tonight, use one tomorrow, go back and forth, that kind of thing. And certainly if you're not getting too dry, you can increase it to every day. That's totally fine. Some of these creams, especially retinoids, are labeled as to not use in sunlight. It tends not to be a huge problem. The main issue with that is the retinoids are a fragile molecule. So if you put it on and you go out in the sun, a lot of times the sun will inactivate it and you won't get the full effect. But other than that, we don't worry about that part too much. Generally, people do fine. So if you want to use it in the morning, that's fine. Otherwise, evening works well. If you need to put other things on after, go ahead and put the acne cream on first. Take a tiny bit. Just rub it into the areas. Don't goop it on or waste the cream or anything. Just put a tiny bit on. Let it soak in for about 5 or 10 minutes and then go back over it with anything else, such as a moisturizer, foundation, makeup, whatever it is. So finally, I personally tend to recommend natural moisturizers, natural creams, that kind of thing. So with natural moisturizers, there are many different brands out there. Burt's Bees does some, Tom's of Maine does some, and there are others, and it doesn't matter. Find something reputable. But a lot of them have coconut oil in them, have shea butter, have cocoa butter. They tend to be a lot safer and healthier from my perspective, so I do personally like them. So I hope that helps. If you have any questions or concerns or comments, definitely leave them below, and I'd be happy to take a look. And otherwise, thanks for watching.